Our healthcare facilities are also scattered everywhere all across the state. I don't think no matter how much infrastructure or the equipments or the other things you put in, if the patient, we will not be able to give the required services to the patients that they require, and the health outcomes will not show any improvement. That is why solving just one issue would not solve the problem for us. It's the other things also that we had to look at. I was thinking like, we had already discussed a bit in the morning but not full, so I would have put up much tougher questions.
I'm being joined by Madam Mehtab Chandee, Sangma from Gambegre constituency. Ma'am, this time we've witnessed you've been very vocal, and also for the first time we've seen you participating in the question and answer. What I wanted to ask is very pertinent questions you've asked, and since you being a doctor, your profession, you see that there is a huge concern about the shortage of doctors. How do you think that is the way forward here for our state?
So, that is what I was trying to bring to everyone's attention this time. That if you look at our healthcare system, the government is trying to do its every bit in whatever it can to improve the infrastructure and the equipment. But when it comes to manpower or the human resource, we're still lacking a lot. And that is where I was saying that we need to find a different way to tackle this problem. Because unless and until we find the manpower issue resolving, I don't think no matter how much infrastructure or the equipments or the other things you put in, if the patient, we will not be able to give the required services to the patients that they require, and the health outcomes will not show any improvement. So for me, I feel that the way to look at it is to do a proper assessment of the current setup that we have, and to find the deficiencies in it and address it in a way that it should be the main problem of the human resource, it should be looked at.
Ma'am, there's also another concern here that we've often seen whenever doctors, they get a posting, they often hesitate after the recruitment is done, many, and they tend to resign. Do you think that it's because of remoteness and also the lack of proper facilities?
Absolutely. Absolutely. So it's not just one factor that's contributing to the problem. It's a lot of other things that we need to see, because as you can see that our healthcare facilities are also scattered everywhere all across the state, and some are remote and some are in towns, and we can see that generally all the specialists, they want to be in the towns, and it's not their fault. It's because they ultimately also have a family to take care of, and if you look at it, if with the families, they need a schooling for the children. So we can see that sometimes when all this manpowers they have with the families, if they come, then I think we also need to look at the other environment, the other facilities that we need to provide, and hence these amenities, these facilities should be available at the remote areas also. And that is why solving just one issue would not solve the problem for us. It's the other things also that we had to look at.
Ma'am, also one very acute moment, we may say, that internet has gone gaga over you and Chief Minister, the cute moment. How do you react to that, and what do you see?
Well, in fact, that day I didn't know that he would be, of course he's CM, and any time, the minister is absent, then he has to take the questions for them. So I knew that my question was somewhere around 6, so I was hoping that it would come, because I had not been able to take any of my questions publicly. So when he stood up to take the question, then of course I was thinking like, we had already discussed a bit in the morning but not full, so I would have put up much tougher questions.
So that means you're not going to go easy on the Chief Minister, even if it's your husband?
Not at all. We discuss a lot of things, but not the supplementary questions or the questions as such. Yeah.
Okay. Thank you so much, ma'am, for your time.
Thank you.
Well, that was the Gambegre MLA, who is, we have witnessed a very good participation this time. NPP is the government, it's a NPP-led government here in the state of Meghalaya. However, yet we could still see that Madam Chandee had participated, and questions were raised. And remember that her profession, she coming from the medical field, also has a lot of knowledge. And what she has mentioned is that a lot of, a robust check has to be done, and that there is a concern relating to the doctors and specialists in the state of Meghalaya. These are information or an interaction that we just had with Gambegre MLA. Thank you for watching. This is Princess Rashir for EastMojo.
Don't forget to like, share, and subscribe to East Mojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.